joking. The rhinoplasty is $35,000. $35,000. I need a nose job. I'm at the consult for rhinoplasty. So I'm at Dr. Kanodia's office, and we just did the photos.
Like this, a little bit more. And look straight forward again. And then profile, turn to either side. And then smiling. Other side. Okay, and then face me. We're going to do one more. I'm going to draw on your face with eyeliner.
Okay.
And then we're going to wipe it off after. But it's just to show how wide your bones are in the photos.
Okay.
Okay, that's it. Yay!
They also just put like these little dots on my nose just to see like how wide it is. So I'm just like, I'm super nervous. I don't know. I feel good about it, but there's still a few other doctors that. Oh, hi. Okay, he's here. Okay, we're gonna look at my nose, guys.
And it does not hurt at all.
No.
And your septum is straight. And septum is straight.
Okay, cool.
Since the camera is here, sit there.
Okay.
Now let's bring a mirror, please.
Okay.
I want to hear your thoughts. What are your thoughts about your nose? What you think? Or
I feel like it's just wide. I think it's just a bit wide. Like I love the bridge. I love like my side profile. It's really not my issue, but I do think it's just a bit wide and a bit overpowering for my face.
Okay. So two things. There's the upper half of the nose, which is the bone. Here, look at this. These are bones. Can't go any further. Huh? So the bones are a little wide. So the bones from here, if I move them to here, to break them from here to there, you see you're gaining some space and it looks softer version of the same nose.
Yeah.
So that's the bone.
Okay.
Narrowing of the bone.
Okay.
Now comes the lower part. Can we refine the tip a little bit? And do we tuck the nostrils a little bit? Okay. So the nostril, the classic nostril cut is right here, and which is not. So if you cut it here to narrow it, it's not a good look because from the side.
Yes, that looks crazy.
Yeah. So what I've done is I've modified the cut. I will go in at the bottom because the camera or the human eye doesn't go to the bottom of your nose. So I will take a little ellipse from here and tuck it in just a little bit. That's all you're going to get. You can't get a very small, tiny, cute button nose. That's going to destroy the look. It's going to look pinched.
No, I definitely feel like I like that because it will kind of still be natural. But what about the actual, like I kind of feel like it's a little bit bulbous, I think is what the term is, about right here. So I understand maybe like bringing the nostrils in and bringing this part in, but what about this? Like I feel like this is a bit bulky.
Yeah.
I don't want it to be pinched. I don't really want the Barbie nose, but I am concerned about the bulkiness here.
Okay. So then there's another procedure. I do everything called close. I do everything from inside the nostril. So if you want a little bit more meaningful reconstruction here, then we have to engage my colleague here, Dr. Swartout. He does open. So he'll cut you open here and we'll reconstruct this area. And so both of us will have to work together. I will be doing this part, narrowing of the bones, okay, and tucking the nostril. But this reconfiguration, he'll have to do it. With my closed technique, I go from inside and I will take away just a tiny little slivers of cartilage to give you just a little bit definition right there. And you would say that's not enough. So if you want a little bit, so that's a discussion you and I need to have, and we'll go into a little bit more details. So I think my suggestion will be that you should see Dr. Swartout also. In certain cases, we do work together.
Okay.
He configures this because with the open approach, he's peeling the nose and he's got a direct access. No, he's got a direct access. He fixes it. And the way he stitches it, you have no issues.
Okay, and then also let me ask you this, because one thing I did like from what I've seen with you is that you do try to maintain the integrity of the nose and keep it like harmonious with the face. So given my concerns about the tip, do you feel like working with him and maybe like doing some refinement to the tip would be beautiful, or do you think then I'm venturing on the side of weird?
No, definitely never going to be weird. Because
Okay.
if I'm in control, which I will be,
Okay.
even when he's working, I'm very fastidious about that it has to look like it was never touched.
Exactly.
Okay? So I cannot stand a nose. So there are compromises in life to make.
Okay.
And if I see that if too much here will make it look pinched or make it look
Mm-hmm.
done, then we're not going to go there. Yeah,
Okay.
But with the open technique, there's better possibility of sculpting it here.
Okay.
If you said, no, I kind of like my tip, just narrow this and narrow this, I can do that. I can get a little bit of refinement, but not because your texture of your cartilage is mushy. So it doesn't have that texture the cartilage usually has.
What about thick skin? I've been seeing things about thick skin. Do I have thick skin? Like, would I have to do like some steroids or Accutane prior to?
Nope.
Okay, no.
Absolutely.
Okay, and then my next question is, okay, so okay, so then if you were to be working with him, right, does that mean it's going to be more of an intense sort of procedure because we're doing open as well? And are there any risks associated with that?
No risks. I don't take risks. So having him there, it's more of two surgeons working together. It's a lot more of his time, a lot more of my time.
Okay.
Even when he's working, I have to be there. And when I'm working, he has to be there. So
Okay.
two surgeons take the responsibility to work together. So it's a lot more work for us.
Okay.
But the two minds, one open, one closed scholars, two best in the field, they're working together to get the harmony and keep it natural.
Okay. And then in terms of like the potential of what it will look like, do you do any sort of like mock-ups or any sort of like digital design so I can visualize it?
I don't do that.
Oh my God, it's all in your head?
Yeah.
Okay.
And I'll share my before and afters from previously done patient. That's how I communicate the people who are very similar to yours, what I've accomplished by narrowing the bones and all that. And he does the rendering. Dr. Swartout is here. He does the rendering. He will show you what he will accomplish with the tip, the refinement.
Okay.
So we'll see. Are you local?
Yeah.
Okay. So we'll see if he can see you today, and if he cannot see you today,
We'll make another appointment. That's cool.
very near future, we will get an appointment. Let's go and chat a little bit more. Come with me.
Let's all go, guys.
So what are you shooting? So beautiful profile. I love the profile. Even both sides of the profile is incredible. So you're going to preserve that. When you look at the bones are wide. See, this is where the bones are. And they don't belong there. Just narrowing the bones with to hair, so you look to be broken, and narrowing the bones to that will make a difference. And softer version. I love this triangle. I love this tip nostril triangle, and this is my modification. Most doctors will make a cut here to narrow the nostrils, but I modified it. I'll go in here, because the human eye or the camera doesn't go under the nose, and we will get a little bit of the top by removing this little bit of extra skin. We'll get a little bit of top, not too much, because then it'll look pinched.
Okay.
So, but this shows me that you do not need a lot of tip work, because there's a beautiful triangle. Tip nostril complex looks pretty good. There's a nice reflection. So I'm not sure, because if you try to do too much here, it will disturb this triangle.
But then how do we make it look so, like this? Pick that right there is wide, like this.
No, but anybody, whenever they smile, the nose will smile. Cheeks are smiling, eyes are smiling, nose is smiling, mouth is smiling. So it has to smile. This is an active muscle.
Okay.
So, as a matter of fact, it looks weird if you tuck it too much, because everything is smiling and the nose is frozen.
Okay.
So this is just a minimal approach. I think you got great cheekbones, great mouth, great eyes, so you can't go for a small, cute little button nose. That will not look good.
I've been talking about this journey, and the viewers are concerned that I'm trying to do a cute little button nose, and I'm not. So the fact that you are trying to, I guess, warn me against that it's a good sign.
Yeah, because I think if I look at you, sitting at the next table at a restaurant, my first impression will be this great harmony between the face, the eyes, the cheekbone. Everything has to be taken into account. You just know it's not sitting isolated. It's the center of the drawing.
Yeah.
It's the center of the sculpture right here. So everything has to be taken into account. And yes, if you look at it really up close, yes, the nostrils are really wide and nose big. But if you step back and take everything into the frame, then it's not that bad at all. So that's why when you come to that conclusion, your work has to be very minimalistic and naturalist. Yeah, because otherwise the risk of pinching is just absolutely it scares the hell out of me. So
Okay.
I'll show you one example. Look at this example. I'm sure you've seen it.
Yes, this is why.
Really wide.
Yes.
Okay? And so looked like everything was out of proportion, but it was mostly the bones. And look what happened when I narrowed and squeezed the bones together. Beautiful softness.
It's beautiful.
Yeah.
But it also kind of looks like her tip is a little bit different too.
Just a minimum. My
Okay.
approach, we did not get Dr. Swartout involved. I just took away a tiny little bit here, tiny little bit here. We did not cut her nostrils, so there's no nostril reduction. But I think the main improvement came from narrowing the upper half, and you can see that right here.
Okay. So then for me, it's like, what about breathing? I have heard some concerns where people, they get a rhinoplasty and then they have issues breathing afterwards.
Let me hit the thing. So breathing is two important things in the breathing, and that's what I was looking at you in there. The septum is one nostril, and your septum is straight.
Okay.
But there's another element in the nose. When you breathe dry air, a lot of air conditioning, or if you have a cat or dog sleeping with you, this turbinate doesn't like it. It swells up to that size. So whole night, instead of like being here, you're there.
Okay.
Why? Because either you're using excessive amount of air conditioning, or you have a cats and dogs sleeping with you, and so you have to have a humidifier like that right next to your bed, pouring mist on you. That's how I sleep. Pretty much everybody has the issue because we live in urban environment. We close all our doors and we use tons of air conditioning. Okay, so cut down the use of air conditioning and maybe get a humidifier. Then you have no breathing issues at all.
Okay.
Your septum being straight, I'm not correcting that. I'm not touching that. I don't want to inflict another injury to a tissue when it's not needed.
Okay.
Turbinates I do not cut because they have a function. They have a function to protect you from dry air. They have to swell up to make more moisture, so that's the function. That's why understanding the physiology and the anatomy of the turbinates, I will not cut it. Most doctors don't understand that, so they will reduce it and they end up with what's called a dry nose syndrome, so you're not able to create more mucus.
Gotcha.
Okay? So at the moment, if you see that you have any congestion issue, then we get this humidifier, scan it, take you to my website, tells you why you need a humidifier, and it's going to be coolness, ultrasonic humidifier, and it's going to be right next to your bed. If it's 3 feet away, it's non-moisturizing. Okay, so it has to be right here as you lie down, like this girl is sleeping. She
And
has
just like
moisture on her face. Yeah.
Okay. Okay, cool. So then I know that you said that you don't think that I should do the open. You like at this point you kind of feel like it may be a little bit too pinched, but just for good measure, I still would like to see your colleague just for good measure.
Absolutely, absolutely, we should do that. And if you feel that having him in the team, then we should do that. Because my job here is to educate you and give you all the facts, and then you can decide. Again, you will if you say, I trust Dr. Kanodia and I don't want too much modification in the tip because of this beautiful triangle right here we have identified, and so then you stay with me. And if you say, no, Dr. Swartout can do a little bit more work on the tip, and then let's include him. And so, our goal is to give you the best natural looking nose. So if you can combine the forces, we'll do that. And if you say, no, I don't want to risk a scar here and all that, because I'm looking at you from different angles, and I think your tip is good. And this proves my point. It's a beautiful triangle. It's a very pretty triangle you draw.
Okay. Okay, I appreciate that.
So
Thank
these
you.
pictures will go with you after you talk to Lisa.
Okay.
And so first talk to Lisa, and then Lisa will try and arrange either today or another day that you meet at Swartout also.
Okay, cool. Thank you.
Question for you. What is your experience with rhinoplasties?
They call it ethnic rhinoplasties online. Like your experience with people of color.
Like, yeah, working.
I do it all the time.
Okay.
Yeah, so that was like in the beginning. I did a lot of black celebrities there.
Okay.
So ethnic means also Arabic, Indian, Chinese. It's again, the key is to preserve. The moment you try to change the ethnicity of the nose, and some people do, they want, like Michael Jackson was a perfect example. He wanted to look like Diana Ross, and they only wanted to look like Elvis Presley. It's because his father teased him about his nose, and that was one of the biggest point of contention for him, because he didn't mind his nose as much as his father, and so he kept wanting more and more and more, and ended up with no nose. And so that's why my attitude is, if I see a patient who wants a complete change, I don't do it, because I don't want to have a surgical looking nose. I don't care how much prettier it is, but it has to fit the rest of the painting. The rest of the face has to be in harmony. So you can't just take nose as an isolated structure, which a lot of people do. Patients do, doctors do, and then they go for that copybook, little birdie kind of cute nose, and I don't do that.
Okay, that's good to know. Thank you.
Thank you.
Let's go to Lisa.
The 4-week regimen that we have patients start to prevent bruising and swelling. So because he breaks the bones during surgery, there's a potential of bruising under the eyes.
Okay.
So our goal is to have that bruising gone by the time the bandage is removed, which is on day 7. So stopping all blood thinners 1 month prior to the procedure is super important. So stopping alcohol, aspirin, Advil, ibuprofen, Motrin, vitamin supplements, smoking, anything that can thin the blood. Full list here stops a month before.
Okay.
We even have you stop caffeine 2 weeks before. That's always an eyebrow raiser for sure.
Okay.
Yeah. So it's a regimen, but it's really helpful, and we can kind of guarantee that day 8 after the cast comes off, you can be back to work or school.
That is why everyone looks so good when they come in.
Yeah, so the cast reveal videos you can see, they're 1 week post-op,
It's
bruising's
so good.
gone. If anything, there might be a little bit of light bruising left, whether or not that patient followed the regimen or not, we don't know. But this is the regimen we recommend. We also provide arnica, that's a homeopathic remedy for bruising. So yeah, you're getting all of our secrets. Now you're going to share it with everyone.
She's like, girl, don't post this.
Listen, but yeah, this is something he does a little bit different. So, we've had so many patients that have had plastic surgery elsewhere. And I'm like, what? I never stopped anything before surgery. I'm like, well, how long were you bruised? Oh, for weeks, for months, for this,
Yeah.
I mean, this is one little step that he does to make sure people have a great result as far as that goes.
Guys, why did they just tell me? That the fucking... Why did they just tell me that the rhinoplasty is $35,000. $35,000. I need a nose job. Okay, so $35,000 for Kanodia, and then it is $40,000 or something like that for both of them if I did both. How bad do I really want this? I don't know. Like, do I really need it? Okay, these was going through something. Do I really need it? I don't know. Doctor's in here.
So, what are we talking about today?
Okay, so rhinoplasty. I just saw Kanodia. He does this whole closed situation, and he's a bit more conservative. I'm thinking that I may want my tip done a little bit, which is why we would need to tap you in. But we just wanted to get your opinion on it. He thinks I don't really need it. I'm kind of like, so yeah.
So, have you had any surgery on your nose?
Nope.
How's your breathing?
It's cool. It is a little bit stuffy. I think I have a post-nasal drip. I'm pretty sure I do, actually.
What's a postnasal drip?
It's like, you know what it is. You're testing me.
No, I'm hopefully about to teach you something.
Okay, so I feel like mucus is dripping in like the back of my throat. So I'm constantly Or like if I don't do this, then it like drips.
So one of the causes for postnasal drip is if you produce excess mucus. So normal humans make 2 liters of mucus a day. So if you're producing 2 liters of mucus a day, that's normal. But what's the reason that it's gotten your attention? One of the really common causes of what people call postnasal drip is actually acid reflux.
You're a lie.
You have acid reflux.
I don't have acid reflux.
Acid reflux is really common in the Western diet, and it irritates the back of your throat. And it usually occurs when you're laying down. Like if you eat dinner, your body starts to produce acid in your stomach, and then if you lay down, a little bit of that acid can wash up and irritate the tissue in the back of your nose, all the way up.
But the thing is, I'm like even experiencing it now. Like I experience it 24/7, and then particularly when I'm talking, it's like worse. Like it just.
So the irritation happens when you're laying flat, but then it's irritated all day.
I see.
And then the mucus, the normal mucus, now is like more. You notice it more, and you feel that there's like a blob of mucus in the back of your throat you have to clear out.
Exactly.
So a really common cause of that is acid reflux. But most people don't want to hear that.
No.
So you're also normal in that way.
Thank you.
But if you wanted to test it, it's pretty simple. You could take an antacid, like Prilosec or Prevacid, an hour before bed, and do it for about a week. And if you notice a difference in that feeling of mucus, then maybe I convince you a little bit.
Okay, I'll try.
The other reason you could have lots of mucus is if you have allergies. So do you?
I think I
have
do.
You ever used
but
allergy medicine?
I did, but not long enough. I don't really like medications. And then I was supposed to go get tested, and I just did not go. But I will.
So surgery on the nose isn't really a good treatment for allergies, because allergies is more related to your immune system. So if it is allergies, then you might want to treat it with allergy medicine, like something like there's over-the-counter medicine like Flonase or Nasonex. It's a nasal spray. It's a steroid, and it'll reduce the irritation in the tissues in your nose and you'll produce less mucus. You could try it.
Okay.
So that one you probably should use for about 7 to 10 days before you'll see a difference.
Okay.
It won't have an immediate effect.
Okay. Cool.
Next, have you ever worn breathe right strips on your nose?
No.
Have you ever had filler injected into your nose?
No.
Have you ever taken Accutane?
No.
Have you ever had any bleeding problems? Like
no.
Excess bruising?
I do bruise, like I can bruise, and then also scarring. So I do have PIH.
PIH.
Post-inflammatory hyperpigmentation.
Oh, okay. Where have you had that?
Everywhere. Like you could nick me, it'll be a scar.
Oh, really?
Have a pimple, it'll be a scar.
Okay.
Yeah.
Smoke or vape?
Nope. No smoking, no drinking.
Okay. And then what are your ideas about how you want to change your nose?
I just think it's wide, to be honest. So I just feel like it's wide, particularly the base. I think it's just wide, and I kind of feel like it overpowers my face a bit. I love the bridge. Like my side profile is immaculate, but like even here, it's just, she's just a little bulky. But I don't want to, what do you think?
Of your nose?
Mm-hmm.
I like hearing what you like, and then I want to examine it, and then I'll take some pictures, and then we can look at the pictures together.
You want your own pictures?
Yeah, I do them a little differently.
Okay.
It's a system. I'm going to take a look at your nose.
Okay.
Put your chin up just a little bit. Let's take some pictures and let's look at them on my computer.
You don't have any thoughts yet?
I do have thoughts. Yeah, we'll go over them with the photos.
Okay.
Yeah, I have a system. So you like the bridge?
Low key, I do.
Or the whole thing?
I like my side profile. I think it's cute.
Like even this?
Do you like it?
Because you were saying you wanted to change the tip.
I do. And
but
so,
not from the side?
yeah, like the front. The front.
Only the front.
What are you?
So sometimes there's a way to change it from the side that would improve it from the front, but it would change it from the side. And if you really love the side, I don't want to suggest that. So if I stuck the tip out a little bit more, it would look narrower from the front. The closer it is to your face, the wider it is. And the more projected it is, the more it sticks out, like kind of straight out that way, the more narrow it is from the front.
I would need
But it would change a little bit from the side. I can show you that if you want.
Yes, please.
I think your profile is great.
Thank you.
But if I wanted to use all the tools to try to make it narrower from the front, one of those would be to stick it out just a little bit. And what that would do is help bring down this area right above the tip.
That's very subtle. I don't mind that.
This shape from the side, how it's kind of curved here, if I make it where it comes down to a smaller point right there and then comes around, from the front, it'll look more shadowed on the top. So it'll kind of help the tip look a little bit better from the front.
Okay.
It's pretty subtle.
That's very subtle. But what would it look like from the front? Because this is the thing, you know, no shade, which means no disrespect. But I feel like every time I see or there are consults about rhinoplasties and nose jobs, I feel like it's always from the side angle. And again,
I'm going to do the front and the side. But before I switch to the next thing, I want to like try to talk through the side.
The side
and then
looks
we'll
cool.
go to the front.
Yeah. So like that little tweak, it looked cool. It wasn't crazy. I feel like it still looked natural. I'm good with that.
Yeah. The side, the thing about the side is when you use this program, because there's like blue background against your skin and you move it, it looks like a nose. But from the front, if you don't know how to change it, it can look really strange with this program. And so that might be why people don't want to do it from the front.
I see.
So you said that you wanted to narrow it, especially at the base. Are you talking about the distance from here to here? Down here, closer to your...
Yeah, like here to here.
Or the base, meaning the bottom of your nose?
Both. It just looks to me, I guess the terminology is maybe bulbous and just wide. And I just want it, like I don't want to pinch nose. I don't want to bring it in too much, but...
Are you talking about the width of the tip portion or the width of the whole thing?
I think
or both?
Like this whole, like this.
The whole thing? Are you talking about the width from here to here?
Here, here, here.
Let me show you what I think. So you have pretty thick skin. And thick skin means it's hard to be really dramatic with the surgery. But it also means that it's likely that it's going to look really natural.
Okay.
So if you're up for that.
I want it to look natural, just smaller.
The downside is that it might be too subtle. But I think too subtle is better than...
Crazy.
Crazy, yeah.
Okay.
I wouldn't really ever do something that could end up looking really crazy. So creating a little bit more definition in here. And then bringing in this is the base. That's what we call the base.
Okay.
There's a technique where you cut along the sides of the nose, all the way up the side. I don't do that because I think the scar is too visible. But that's the most dramatic way to narrow it from the side.
Okay.
And the way I do it is with a cut inside here. Okay. So it's more hidden, but it means it'll be a little bit more subtle. It's pretty subtle.
Oh my God, that was so cute. Was that not the cutest little nose ever?
Is that enough of a change?
I think that's so cute. What do you guys think?
You're just getting my nose and just say that.
Oh my God, yeah, no, exactly, literally. This is my sister by blood from both people. Look.
Beautiful.
I have a perfect nose.
I think you have a little bit thinner skin.
I've heard
so you have a little bit. You have a little bit of like a a more defined, separated tip.
Exactly. So this is
You have more of like a less definition between the nostrils and the tip.
It's what the people pay for at this nose.
I'm saying this is what I want to pay for. I'm so happy that you're here. So basically this on me. But I've heard some people say take like Accutane or get steroid injections before the surgery to help thin out the skin. What do you think?
So Accutane will thin your skin and it's permanent, but it's got some downsides.
Like
It can make your skin too dry. It can make your eyes dry. It can mess the GI tract. And if you need it for acne, it's worth it. If you're using it to thin the skin, it might not be worth the side effects. But there's also you can do a different dose or a shorter thing. Or you can talk to the dermatologist about it. But they usually tend to think it's no problem, you know. But
I mean, given that you may possibly be doing the surgery, would it be of any benefit to you to thin the skin out before the surgery or no?
So if you take Accutane, then you probably shouldn't do surgery for about 6 months to a year to let it heal once you're done taking the Accutane. And if you want to take it afterward, you should wait at least 3 months after the surgery to take it.
Okay. I think what I'm trying to ask you specifically, are there any benefits to doing
I'd rather you not take it.
Okay.
But if you took it, if you decided to take it and you finish, you have to wait 6 months before you do the surgery.
That's one patient.
Well, yeah.
Yeah.
If you're thinking it's possible that taking the Accutane would create enough of a change where you wouldn't want to do the surgery, then it might be worth doing it before. So you could take the Accutane, then you could see the effect, and then you could decide maybe you don't even need surgery.
So when you say thin, okay, so when we are talking about thick skin versus thin skin, how would it actually change the size of my nose? Like
so underneath the nose is this cartilage framework. And the cartilage framework is what creates the shape of the nose and the size of the nose. Not so much the width here, but the shape and the size of the tip. And if you have like a small nose under the layer of cartilage, and then you lay thick skin on top of it, it'll appear wide and bulbous. But if you put really thin skin over it, it'll look small and pointy.
Okay.
And if you put medium skin, it'll look like that probably.
Like Pookie.
And so by thinning the skin, your nose will appear
A little
smaller. But but it probably wouldn't change it here, this width. But it would change where the shadows are. So the way I changed this nose on this picture is I move these shadows down. See how the shadows look way up here? Mm-hmm. So it's this part's round, right? Mm-hmm. And then afterwards, see I put the shadow here? Mm-hmm. So it makes it look like this part's really small. Like this is the part that's curved as opposed to curving all the way up to there. Like that.
Yeah. Oh, wow.
So that's the idea of these shadows. So it's kind of similar to contouring makeup. Exactly. So you put like a shadow on the side. You put in shadows here. You put a highlight right there.
So do you think that it would be a benefit given kind of like what I want to have you and Dr. Kanodia like going together?
I think it would look good. I think the downside is that it could be too subtle. And I think
with you as well?
Yeah, with the thick skin.
Oh.
But it sounds like from talking to you, it doesn't sound like you want something really crazy.
I don't.
And I also kind of try to judge it by how you react to the photos, like how I do the photos. If you really like them, that makes me think I can make you happy. But if you look at the photos and you like press me to make it smaller, then I feel like, I don't know if I'm able to achieve all that. And so
I think that is beautiful.
So
question. So with the work he's doing plus your work, would it essentially look like that as well?
So I'm using these photos to try to communicate to you what I predict it'll look like, but I can't 100% predict it, right? And so I need a little bit of a buffer. And so I can't make it look exactly like this, but I also look at my photos of my patients 3 months, 6 months, 9 months, and a year, and then I look at how I did the photos. And so I'm changing the way I do the photos based on how my results turn out.
Gotcha.
So I'm doing it as accurately as I can, but it is there's a little bit of guesswork to it, but that's where kind of experience helps. So all I do is rhinoplasty and pre-ops, post-ops.
What do you think about
surgeries.
making the tip
You're doing too much.
Okay, a little bit too much.
No, say it. I also want to get to know you,
Like,
because if what you're,
let me show my reference photo.
Oh, God.
were you starting to say, could it be a little smaller? Is that what you're starting to say? Yeah, so remember what I said before about that?
Don't listen to her. Don't listen.
That's like Motrin, Advil, Aleve, Naproxen,
Yes.
Midol.
Yep. Mm-hmm.
No high-dose vitamin E.
Mm-hmm.
Do you take herbal medicine? Ginger, ginkgo biloba, ginseng? No fish oil pills? And no Accutane for 6 months before or 3 months after? And then you've never done filler in your nose? Okay. And I guess there's one other thing. I want to show you some incisions too. Let's see. So some of my examples of the patients that I can only show it in the office.